So the pathophysiology of inflammation associated with sickle cell and beta thalassemia is very much complicated. We know nowadays that this is a hallmark of these diseases and underlies multiple complications associated with them. What we have learned in the last couple of decades is that, of course, a major trigger for inflammation in these disorders is hemolysis and also iron dyshomeostasis. So we know, in fact, that in sickle cell disease and beta thalassemia, different mechanism of hemolysis occurs. Mostly the hemolysis is intravascular in sickle cell disease, where red blood cells break in the circulation, releasing their content of hemoglobin and heme, whereas in thalassemia it's mostly extravascular, occurring due to the engulfment of altered red cells by macrophages. However, at the end of the day, in both diseases, a lot of systemic heme is released. So these patients have elevated free heme in their circulation with almost a complete depletion of their scavengers molecules, aptoglobin and hemopexin. And heme has been clearly described as a very pro-inflammatory molecules. So what we are interested in the lab is indeed to study how heme mediates the activation of a number of cells, which ranges from vascular cells to immune cells, such as monocytes, macrophages, and neutrophils. And a few years ago, we have described that heme triggers the activation of macrophages. And we have also found that iron does this in a very similar manner to heme. And iron overload is often also a feature of sickle cell disease and beta thalassemia, because these patients receive chronic transfusion regimen to correct their underlying anemia. So this is a major topic we are exploring in the lab, trying to understand the intersection between heme and iron dyshomeostasis and inflammation and activation of immune cells.